Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and today we're going to talk about, very importantly, a beautiful Sunday today. First of all, a very beautiful Sunday today, and we have three sessions lined up back to back. This class is at 11 o'clock, then we have a class at 2 o'clock, and then we have a class at 4:30. Today, in this session, we're going to study something about cardiology, and in the other two sessions, we have a cardiology test. We have some 100 MCQs of cardiology, which will be done in part one and part two. And let's see that how much have you read cardiology, how much we have revised cardiology, and how much we can, do questions regarding cardiology. So this is the Unacademy NEET PG platform. My name is Dr. Anand, and welcome to this Unacademy PG platform. And first of all, a wonderful congratulations to all the amazing students who have worked really hard and have got this FMG December 2021 exam. All these students have done wonderfully in their job, and they have done a commendable response they have given, and they deserve to be here. And now it's your turn, guys, who are working really hard. I want your faces, your names to be there in the upcoming exams and sessions. And also we have a free test calendar for the medical PG preparation, and this is one of the best thing which is there. And because we should always give a lot of tests, because the more and more tests you will give, the more it will be nice for you, the more chances you have that you will crack the exam. And also for the newcomers, we have something known as plus subscription and something known as iconic subscription. In the plus subscription, you get all the access to my live and recorded classes. You get to learn from the best of the best educators all over the India, and you get to participate in various live tests and quizzes. Today we have three sessions on YouTube right now at 11 o'clock, then we have at 2 o'clock, and then we have at 4:30. 2 o'clock and 4:30 sessions have a cardiology test, pediatric cardiology 100 MCQs, part 1 and part 2, and we'll do as many MCQs as possible. A lot of new questions gonna come in the test. Let's see how you well answer. This is the plus subscription. Hello, Dr. Savan Singh. Savan, thank you so much for Puri Chole. Yesterday, Savan had come in my hospital, and we had a good dinner together. And thank you so much, Savan. And also at the same time, this is the iconic subscription for the newcomers. With the Unacademy platform, you get the Prep Ladder subscription also. All the clinical notes, video lectures, question bank, rapid revision, and dream notes. Everything you get on the iconic subscription. So we have plus subscription and we have iconic subscription. And as this is a YouTube channel, we have a Unacademy app also. For the newcomers, please download Unacademy and write Anand Bhatia there, and you can watch all my lectures totally free of cost. So in the special class, basically we have the options of asking, making a MCQ poll. We can ask any doubt. We never miss the classes because all the lectures are wonderfully synchronized in a proper manner, and this is the special class features. Okay. And also we have already made a batch of focus FMG 2022 and a target NEET PG, what you call the target NEET PG 2022 batch, and it has going amazing, and I hope you guys are a part of it. Okay, so that's it. That's all about plus subscription, and then we have iconic subscription. And being a MBBS student, sometimes it becomes difficult to buy a expensive pack. So if you use this code, it will be little beneficial for you, and it will be nice if you use it. So that's it. Let's start the cardiology session. Yes. Okay. Export in, क्या हाल है आपका? कई दिनों बाद, सालों बाद आए हो. So let me say good morning to everyone. Hello, Mani Prakash, Exportin, Savan, Clara, Rachna, Priya, Zainab, Shubhangi, Robin, Hamid, Suresh, and many, 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 many more people. यस. तो या आज की कहानी शुरू करते हैं, और शुरू करने से पहले वी ऑलवेज हैव अ मोटिवेटिंग कोट, एंड टुडेज मोटिवेटिंग कोट इज अ वेरी गुड वन. इफ यू वांट टू बाय थिंग्स विदाउट हैविंग अ लुक एट द प्राइस, if you want to buy things without having a look at the price, then work without having a look at the clock. A very wonderful quote. If you want to buy things without having a look at the price, then work without having a look at the clock. So don't see the time, just work hard, work hard, work hard, and you will get it. Just keep working hard, don't stop. Okay, don't you can't really calculate your hard work. You just have to work hard, that's it. Okay, and everything will come, everything will come. And for this quote, I would like to thank Dr. Ishita Srivastav. She had given me, what you called this quote. That, sir, this quote is really good, you should use it for the students. And thank you, Ishita, for sharing this quote with us. So now today's topic of choice, yes, cardiology cardiology, and we had a homework. Again, Pancake has not come. I think one of our student, Pancake, she loves sleeping, I guess. She is still sleeping in morning 11 o'clock. It's okay. There was a homework I gave to the students was this was the homework. Where to look, because in every class, remember guys, I will be discussing the homework which I have given you, and by the end of the class I will give you a new homework so that we can keep connected, and you also go home and study. Okay, so the question is, Hanji, okay, अच्छी बात है. Hanji, the question number 3, this question is where to look for preductal oxygen saturation in patent ductus arteriosus in a 3-minute born infant. What do you think, everyone? हाँ जी, स्टेफिलोकोकस मॉर्निंग एक्सपोर्टिंग, बहुत अच्छी बात है ब्रो, बहुत बढ़िया. Now, could you answer me this question? Where do you look for preductal oxygen saturation in a case of PDA in a 3-minute old infant? NEET 2019 question. The options are left upper limb, left lower limb, right upper limb, right lower limb. So what do you think, anyone? What do you think, guys? Whatever random answer, if you can give it, the more you participate, the more it is nice. Why? Because if you do participate, you will do mistakes, and mistakes are a proof that you are trying. Okay, very good. Hanji, so we have a lot of students, Tanu, Vaidehi, very good people have participated today. So the best answer for this question will be our, okay, let me just tell you first. Okay, the best answer for this question will be our right upper limb. Right upper limb. Now see, cardiology is like maths. Okay, you can't cram anything, you have to understand the concept. Now listen very carefully. So where to look for preductal oxygen saturation in a case of patent ductus arteriosus in a baby? That's what the question is. So we know that, right? Okay, now see this carefully. What happens? The purified blood, basically from the pulmonary veins, the purified blood enters from the lungs to the left atrium with the help of pulmonary veins, yes or no? So this purified or oxygenated blood enters the left atrium. Then this oxygenated blood enters the left ventricle, and this oxygenated blood basically enters the aorta, yes or no? So aorta is divided into, in the aorta we have something known as brachiocephalic artery, and this brachiocephalic artery supplies the right subclavian artery, and this right subclavian artery supplies the right upper limb. So now the question is where to look for the preductal. Now preductal means, can we understand this is the PDA, yes or no? And anything before than that, before the PDA, is nothing but preductal, yes or no? So before the PDA connection, the oxygenated blood basically from the left ventricle enters into the aorta, then it enters into the brachiocephalic artery, and then it enters into the right subclavian artery, and this right subclavian artery enters supplies the right upper limb. So the best answer for this question, that where should I keep my probe, my saturation monitor in a case of preductal, then the answer is right upper limb. Because after this because after that we have this patent ductus arteriosus connection. Before the patent ductus arteriosus connection, preductal, the oxygenated blood from the aorta supplies the brachiocephalic artery, and right subclavian artery supplying the right upper limb. That is why the answer for this question, that where to look for preductal oxygen saturation in PDA, the answer is right upper limb. Did everyone has understood, yes or no? सावन ब्रो, समझ में आया या अब नहीं आया? Okay, but even left subclavian artery is above PDA, na? So why not left upper limb? The left subclavian artery, bro, PDA जो bifurcation होता है, see, जो brachiocephalic trunk होता है ना, एक होता है right subclavian trunk होता है और एक left subclavian trunk होता है. So PDA अगर हम ध्यान से बुक में देखेंगे तो PDA जो है right वाले से बाद में होता है. Like see, this is the PDA, no? Before the PDA bifurcation, before this PDA channel, the preductal in the aortic circulation, if you see the anatomy, the left ventricle enters into the aorta, and aorta basically you have a brachiocephalic artery, and which supplies the right subclavian artery, and which supplies the right upper limb. उसके बाद बेसिकली डक्टस आर्टरियोसिस का चैनल होता है, उसके बाद होता है. इसलिए ये सारा जो ऑक्सीजनेटेड ब्लड है वो राइट साइड को सप्लाई करेगा, लेकिन उसके बाद डक्टस आर्टरियोसिस में मिक्सिंग हो जाती है, और वो फिर बाद में जो लेफ्ट अपर लिम, लेफ्ट लोअर लिम, राइट लेफ्ट लोअर लिम, सब जगह वो मिक्स्ड ब्लड होता है. खाली प्रीडक्टल वाला हमारा राइट अपर लिम होता है. ओके, एक बार बुक में दोबारा इसका एनाटॉमी चेक करना ब्रो, यू विल गेट इट. ओके, चलो. Next, also homework I ask, what is differential cyanosis and what is reverse differential cyanosis? So Staphylococcus is asking, where is pancake? I'm so hungry. Pancake दिन में, I think pancake में बहुत fat होता है ना? I don't know. Is pancake, I think must be having some calories, I guess. अगर उसमें fat कम है तो I also like pancake. हाँ जी, what is the differential cyanosis and what is reverse differential cyanosis? Anyone? What do you think? This also question I had asked in my previous homework class. What is differential cyanosis and what is reverse differential cyanosis? Please remember, if my lower limbs are more cyanosed than my upper limbs, if my lower limbs are more cyanosed than my upper limbs, that is known as differential cyanosis. If the upper limbs are more cyanosed than the lower limbs, that is known as reverse differential cyanosis. That is a very important exam question, very important exam question. Okay. हाँ जी. यस एग्जैक्टली वेरी गुड. सावन ब्रो, ठीक है ब्रो, दोबारा देख लियो, कोई डाउट हो तो पूछ लेना भाई, ठीक है. तो डिफरेंशियल साइनोसिस एंड रिवर्स डिफरेंशियल साइनोसिस, व्हेन द लोअर लिम्स आर मोर ब्लू than the upper limbs, that is differential cyanosis, and opposite of that is reverse differential cyanosis. Okay, now example, very can anyone tell me one example of differential cyanosis जिसमें lower limbs will be more cyanosed than the upper limbs? Exactly, very good money, very good Savan. Okay. Yes. Now the answer for differential cyanosis, the answer for differential cyanosis is PDA with reversal of shunt. PDA with reversal of shunt. Now who will tell me why? Now सोच, it's all about maths. Okay, Savan, बता मुझे जरा कि PDA with reversal of shunt, why in this case the feet will be more blue than the hand? What do you think? Anyone? Any random guesses? So PDA with this is PDA, right? This is PDA. PDA with reversal of shunt. So why PDA with reversal of shunt will have feet will be more blue than the hand? Same reason, no? Because oxygenated blood enters the left atrium. Normally, the oxygenated blood from the lungs enters the left atrium. This oxygenated blood enters the left ventricle. And this oxygenated blood basically when enters the aorta, and imagine, okay, aorta it entered, okay, and normally once it goes down, where it will go? This blood will go to the left side, yes or no? Because I mean the right side, because PDA is a left to right shunt. Yes or no? Whatever the oxygenated blood coming from left atrium to left ventricle to aorta will go to the right side, because PDA is the left to right shunt, because of the left side of the heart has a higher musculature. So what will happen? That's what. So number one, the shunt will be left to right. Then what happened? Then pulmonary hypertension will develop, and that shunt will become right to left. Okay, that shunt become right to left. Okay, I'll make the diagram again. Listen very carefully. So this is our what you call PDA. This one. Okay. So what I'm saying here is number one, the shunt which was left to right. Then what happened? Then slowly pulmonary hypertension, or you can say pulmonary atresia, then pulmonary stenosis, and then pulmonary artery hypertension. I told you, normally when more and more blood enters to one vessel, that vessel slowly starts to get closed. So normally the blood from superior vena cava are coming to right atrium, to right ventricle, to the pulmonary artery, and now from the left side of the heart also the blood is coming to the right side of the heart, and more blood going into the pulmonary artery. So pulmonary artery में क्या होगा? Slowly pulmonary atresia will develop, and slowly pulmonary stenosis will develop, and slowly pulmonary artery hypertension will develop, and yes, as Nishi is right, Eisen-Mingerization or right to left shunt will develop. Even though the shunt will be left to right, again the same thing only. The desaturated blood, now read this line very carefully. Desaturated blood from the ductus enters the aorta. In the reversal of shunt, in this right to left, in this reversal of shunt, what will happen? The desaturated blood basically enters the aorta. Yes or no? So the desaturated blood from the ductus enters the aorta distal to the left subclavian artery, sparing the brachiocephalic circulation. Very important point, because this now the brachiocephalic circulation has been spared क्योंकि वो ऊपर होता है, it is above the ductus. Are you understanding? So desaturated blood from the ductus enters the aorta distal to the left subclavian artery, sparing the brachiocephalic trunk, and that is why, that is the only reason my lower limbs will be more cyanosed than my upper limbs. Now this is known as differential cyanosis. Okay. Yes, yeah. Okay, the Manish says, cardiology part 1 to 6 video are not present. Where can I find them? It is there in the app, bro. It is there in the Unacademy app. Watch them there. So this is the most important cause of the differential cyanosis. So PDA with the reversal of shunt, that is the important cause for the differential cyanosis. That is the answer. Okay, and then yeah, that this is the aorta diagram. Like you can understand that I have already explained. And then we have reverse differential cyanosis. What is reverse differential cyanosis? When the upper limb basically are more cyanosed than the lower limb, that is reverse differential cyanosis. And yes, हाँ, ओके सर, के सभी वीडियो हैं फ्री हैं? हाँ जी डॉक्टर रॉबिन, सारे के सारे वीडियो फ्री हैं अकेडमी में, खोल के देखो एक बार, बट वॉच देम एज फास्ट एज पॉसिबल बिकॉज सून द वीडियोज विल गो प्राइवेट और दे माइट गेट लॉक्ड, सो वॉच देम एज मच एज पॉसिबल. So the examples of reverse differential cyanosis, एक example we need to remember, that is nothing but TGA with pulmonary hypertension. TGA with pulmonary hypertension, you will see reverse differential cyanosis. बाद में you later you think, okay, how come TGA with a pulmonary hypertension can get a reverse differential cyanosis? If you get any doubt, you ask me. So now we have covered three very important questions. One is one is differential cyanosis. The example of differential cyanosis will be nothing but, very importantly, PDA with reversal of shunt. PDA with reversal of shunt, that is differential cyanosis. And what is reverse differential cyanosis? The example will be our TGA with pulmonary hypertension, that you should know. Okay, now coming to the Epstein anomaly. Now today's topic of choice, very easy questions on Epstein anomaly, but we're gonna cover the rare points also on the Epstein anomaly, which we must understand. And remember guys, this is the three sessions we're gonna do today: part 1, part 2, part 3. Like the part 10 cardiology, right now we're doing it. In the cardiology part 11, the test, there's a test at 2 o'clock, and then we have a next a test today at 4:30. 100 questions on pediatric cardiology. If you do revise those 100 questions, your whole cardiology is almost over. Almost क्या बिन पूरा ही over हो जाएगा. Okay, Epstein anomaly. Epstein anomaly. So, can anyone tell me, Dr. Robin, Dr. Osama, Shubhangi, Hamid, and our Savan? So, what happens in Epstein anomaly? Can, as a newcomer, like if you can help me, like what is the problem? Where is the problem happening in Epstein anomaly? What do you think, anyone? Where is the problem happening in Epstein anomaly? So, what is this? This is our tricuspid valve. What is this? This is our tricuspid valve. Point number one. Okay, so what happens? Yes, very good. Number one, there is a downward displacement. There is a downward displacement of the tricuspid valve. Yes or no? Do you remember this? The tricuspid valve, there is a downward displacement. That is the first point. Very good. There is a downward. जो भी पढ़ना है, whatever we are studying, my dear friends, have a positive intention, have a very positive and a happy vibration around. Don't be negative. Being negative will do nothing in your life. Only it will create depression. You want to be depressed? Create negative thoughts. You want to be happy? Create positive thoughts. It is as simple as that. So have a positive vibe in your life, in your aura. And we are studying Epstein anomaly. Number one, the whole problem happens in the tricuspid valve. What happens in tricuspid valve? There is a downward displacement of the tricuspid valve. Point number one. Point number two, then what happens whenever there is a downward displacement of the tricuspid valve? The size of the right atrium will increase. The size of the right atrium will increase, yes or no? The right atrium will becomes little bigger, right? Because the tricuspid valve has come down. Okay. Number third, very important. Now, right ventricle, this right ventricle, this. So, right ventricle will not have that much pressure. Right ventricle will not have that much pressure to push the blood into the pulmonary artery. Yes or no? The right ventricle will not have that much pressure. There's a decreased pressure to push the blood into the pulmonary artery. Yes or no? Yes, exactly. So when the right ventricle will not have that much pressure to push the blood into the pulmonary artery, slowly what happens? Slowly that artery starts to close. Slowly that artery starts to close, and that is known as functional atresia. That is known as functional atresia, or that is known as pulmonary atresia. Functional atresia or pulmonary atresia. Okay, are you understanding? This is what happens in the Epstein anomaly. I'll repeat again. Yes, very good. Nishi is right. Okay, yeah, very good. Robin is also right. And yes, Zainab is very good. So, number one, there is a downward displacement of tricuspid wall. Number two, the right atrium size increases. Number three, the right ventricle will not have that much pressure to push the blood into the pulmonary artery. So, whenever the right ventricle will not have that much pressure to push the blood into the pulmonary artery slowly starts to get close, and that is known as pulmonary atresia, or it is known as functional atresia. Okay, atresia means abnormal narrowing, stenosis means total block, and atresia is abnormal narrowing. So then that's why this Epstein anomaly comes as a congenital heart disease with oligemic lung fields. Yes or no? Do you agree with me? Yes or no? Put a like button if you're able to understand, or put a thumbs up if you can agree with me. What is oligemic lung fields? Oligemic lung fields matlab decrease pulmonary blood flow, decrease blood flow in the pulmonary artery. When the pulmonary atresia happens, there is a decreased pulmonary blood flow, and that is known as oligemic lung fields. Oligemic lung fields. These are the first points. Okay. So then next, what are the ECG finding? What is the ECG finding in Epstein anomaly? Anyone? What happens in the ECG finding? How do you read ECG? We have QRST, QRST. So P causes what? P wave causes atrial contraction, whereas QRS wave causes ventricular contraction. Okay, we have A wave, which P wave, which causes atrial contraction, and QRS causes ventricular contraction. So most importantly, what happens? As I told, there is a downward displacement of the tricuspid wall, this tricuspid wall. So the atria becomes very big. So once the atrial contraction will happen, you will find a, what will happen to the to the P waves? There will be Himalayan P waves. There will be Himalayan P waves, or you can say tall P waves. So tall P waves and Himalayan P waves are the important what you call pointers of the ECG finding of the Epstein anomaly, because P causes what you call atrial contraction, and QRS causes ventricular contraction. When the atria is very big, when the atria contracts, you will get a tall P waves or a Himalayan P wave. That you should know. Did you understand? Yes or no, everyone? Yes, समझ में आ गया. These are the very wonderful points on Epstein anomaly for the newcomers, for the old comers. These are the very smart points. And again, already someone has mentioned, if the mother has taken dash during pregnancy, like which drug the mother has taken during pregnancy, the baby can land up into Epstein anomaly. The answer is lithium. If the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. If the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. ठीक है, समझ में आ गया रॉबिन खत्री? गजब गजब समझ में आ गया, चलो बहुत अच्छी बात है. ठीक है, okay, let's do the further questions also. If the mother has taken erythromycin during pregnancy, if the mother has taken, see, I have a very bad habit of linking and studying. एक क्वेश्चन आ गया तो मैं 10 क्वेश्चन और पूछ के वहीं खत्म कर देता हूँ. I have a very bad habit of this. So if the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. If the mother has taken erythromycin during pregnancy, the baby can land up into Priya. What do you think? Exactly. Exportin is right. Congenital hypertrophic pyloric stenosis. The mother has taken erythromycin during pregnancy, baby can land up into congenital hypertrophic pyloric stenosis. Okay, next, if the mother has taken thalidomide, during pregnancy, the baby can land up into, who will tell me? Very good. Rachna, Priya, Mani, Osama, Deepak, Hamid. Very good, very good. Indian Academy also, there's a channel. Okay, fine. So if the mother has taken thalidomide during pregnancy, the baby can land up into phocomelia. Very good. What is phocomelia? Phocomelia is nothing but like seal-like limbs or limb defects. So if the mother has taken cocaine during pregnancy, baby can land up into microcephaly. If the mother has taken anti-malarials during pregnancy, who will tell me? Artemether, arteether, lumefantrine, primaquine, chloroquine. If the mother has taken anti-malarials during pregnancy, baby can land up into deafness. Okay, the baby can land up into deafness. So the mother has taken cocaine during pregnancy, baby can land up into microcephaly. The mother has taken what you call anti-malarials during pregnancy, the baby can land up into deafness. If the mother has taken misoprostol, मान जाऊंगा मैं अगर कोई बता दे मुझे गलती से. If the mother has taken misoprostol during pregnancy, and if the mother has taken danazol during pregnancy, who will tell me? These two, anyone? Should I give you a homework for this, or you will tell me the answer? If the mother has taken misoprostol during pregnancy, and if the mother has taken danazol during pregnancy, what all problems mother can land up into? The people who are answering amazingly are Tanu exporting, Rachna, Osama, Mani, Deepak, Hamid. Very good, very good. The people who are participating has a very, very, very high chance that they will crack this exam without fail, without any doubt. Hanji, exactly. So Robin is right. M for misoprostol, M for Mobius syndrome. M for misoprostol, M for Mobius syndrome. What happens in Mobius syndrome? There are cranial neuropathies. There are cranial neuropathies. Okay. So the mother has taken misoprostol during pregnancy, the baby can land up into Mobius syndrome. How will I remember it, sir? See, dear, M for misoprostol, M for Mobius syndrome, and they will have cranial neuropathies. Next, if the mother has taken danazol during pregnancy, danazol, the baby can land up into virilization. Virilization. What is virilization? मतलब लड़के के अंदर लड़कीपन और लड़की के अंदर लड़कापन. In a boy, you will see female features. In a female, you will see boy features. So virilization. If the mother has taken danazol during pregnancy, the baby can land up into virilization. Very good, Zainab Akhtar. Very good. So has everyone understood this much? Say yes or yes, yes. Or you can put a nice heart, or you can come to Delhi and meet me. I stay in Delhi. समझ में आ गई कहानी? Yes or no? Okay. Hamid says yes, yes. की बात है, ठीक है, आगे बढ़ें, खत्म करते हैं पूरी कार्डियोलॉजी मोती की तरह मैंने कार्डियोलॉजी पढ़ाई है, और आप उसे पढ़ें अच्छे से. इफ़ यू गाइज हैव एनी डाउट इन कार्डियोलॉजी, पुट अ कमेंट सेक्शन एंड आस्क मी एनी डाउट, एनीथिंग. ओके, आई एम अवेलेबल. ओके. ओसामा, प्रिया, स्टेफालाइकोकस, तनु, जाइनब. ओके, चलो आगे बढ़ते हैं. चलो, now let's just finish this topic of Epstein anomaly. Just read the lines with me. Just read the lines with me and say, is this line true or false? There is a downward displacement of the abnormal tricuspid valve into the right ventricle. Is this line true or is this line false? Yes or no? Is there a downward displacement of the abnormal tricuspid valve into the right ventricle? Yes, the answer is true. इतने प्यारे से हार्ट दिए हैं, what he called उसने हामिद ने. Thank you Hamid. True. Next question, next point. And that lead to atrialization of the right ventricle. Is the downward displacement of the tricuspid wall lead to atrialization of the right ventricle? Nothing but the right atrium enters into right ventricle, or you can say there is an inlet or there is an interference basically in the right ventricle. True. Very good. The right atrium is enlarged as a result of tricuspid regurgitation. Now, this is one extra point you need to understand. Whenever there is a tricuspid wall, no, whenever there is a downward displacement of the tricuspid wall, the right atrium is definitely enlarged as a result of tricuspid regurgitation. थोड़ा सा blood, little blood goes back to the tricuspid wall, like from the tricuspid wall, leading to tricuspid regurgitation, and for that reason also the right atrium is enlarged. The right atrium is enlarged. ठीक है. Okay, Nishi Agarwal says बहुत अच्छा पढ़ाया है sir. Thank you Dr. Nishi Agarwal, and thank you, God bless you. Okay, so what will happen? Effective output from the right side of the heart is decreased. Yes, is this line true or false? The effective output from the right side of the heart is decreased. Decrease होती है कि बढ़ जाती है? The answer is yes, that's true, na? It is decreased, right side, the output from the right side of the heart. Why it is decreased, sir? Because number one, poorly functioning small right ventricle. Is this line true or false? Do we have a poorly functioning small ventricle? Yes, definitely. Because of the displacement of the tricuspid wall, the right ventricle becomes very small and it does not have that much pressure to push the blood into the pulmonary artery. So yes, poorly functioning small ventricle is there. I agree with you. Second, because of tricuspid regurgitation also, my output has been decreased. Do we agree with this? Yes or no? True or false? Because of tricuspid valve regurgitation also, the right side output has decreased. Hanji, that's very, very true. I agree with you. And also, there is an obstruction in the right ventricular outflow tract. Naturally, I told you, when the right ventricle will not have that much pressure to push the blood into the pulmonary artery, so slowly this tract only begins to close, yes or no? Though the answer is like obstruction of the right ventricular outflow tract is there or not? True or false? The answer is Hanji, that's true sir. There is a obstruction in the right ventricular outflow tract. है ना, इतना समझ में आ गया? Very good. Okay. Exportin says, sir, I'm thankful forever in my whole life because of मोती की तरह पढ़ाते हो." Thank you. Thank you, bro. Thank you. I love you. So nice of you. God bless you. खुश रहना है, मज़े लेने हैं लाइफ के, बहुत खुश रहना है, सब अच्छा होगा, सब अच्छा होगा. If you have a positive mind, everything is possible on this planet. Everything, anything. You were born to rock. Remember that. Okay. And can we read this line that right ventricle is not able to generate enough force to open the pulmonary valve, that leading to functional atresia or pulmonary atresia? Is this line true or false? Right ventricle is not able to generate enough force to open the blood basically into the pulmonary wall, and that will lead to functional atresia or pulmonary atresia, yes or no? These all are Nelson lines. Okay, these all are Nelson lines. That's why I'm stressing on this line, so that you can understand Nelson. It's like you're reading Nelson right now with me. Okay, so these lines I have taken from Nelson textbook and OP guide, so that you can understand the book language also, and you can correlate yourself. So yes, can we read this line for the last time, that right ventricle is not able to generate enough force to open the pulmonary valve, leading to functional atresia or pulmonary atresia. Done. Next point. So yes, so the increased volume of the right atrial blood shunts through the foramen ovale and produce cyanosis. Now please remember dear, always remember, like in general, what are we reading? We are reading Epstein anomaly, right? Where there is tricuspid atresia. Always remember, like in general, these anomalies basically are not isolated. They are not isolated. They are always associated with some defect. They are associated with some defect. Either there could be some open foramen ovale, either there is a open patent ductus arteriosus, some defect will be there. So now, as I told you, right ventricle will not have that much pressure to push the blood into the pulmonary artery. Pulmonary artery also starts going to close. So will the patient have cyanosis? Yes or no? Will the baby will have cyanosis, or there will be no cyanosis? So the answer is yes, the baby will have cyanosis. Wherever you are bypassing the lung, wherever you are bypassing the lung for the purification of blood. Normally, the blood should go from the pulmonary artery to the lungs, right? And why does it go? It goes for the due to the it causes the purification of blood. So now when the lungs are closed, the lungs are bypassed because of pulmonary atresia, pulmonary stenosis, and this and that. So you will get cyanosis. Definitely you'll get cyanosis. And also at the same time, they are saying that there is a open foramen ovale. Yahan pe over here we have a foramen ovale. Foramen ovale. What is the remnant of foramen ovale? The remnant of foramen ovale is fossa ovalis. Yes or no? If you're a newcomer, we have done the first class we have done on the fetal circulation, and I have explained in depth and detail that we have a foramen ovale which basically helps in shunting the blood from right to left. The blood from the right atrium goes to the left atrium with the help of foramen ovale. So that's what they are trying to say in this line, that increased volume of right atrial blood shunts through the foramen ovale and produces cyanosis. Do you agree with me? Yes or no? मेरी खांसी ठीक नहीं हो रही, कई दिन हो गए खांसी थोड़ी थोड़ी खांसी रहती है. ठीक है, डन, आगे बढ़ते हैं. हाँ. Yeah, and that's why on the ECG you will get a Himalayan P waves. On the ECG you will get a Himalayan P waves. कोविड चेक कराया था ब्रो, मैं भी कोविड पॉजिटिव था लास्ट अभी 5 दिन पहले. तो लास्ट 7 days आई वाज ऑन होम आइसोलेशन ओनली, बट घर बैठ बैठ के मैं क्लासेस ले रहा था. सो दैट्स व्हाई आई वाज गेटिंग लिटिल व्हाट यू कॉल्ड कफ एंड लिटिल कोल्ड एंड लिटिल माइल्जिया. माय रैट वाज पॉजिटिव. दैट्स व्हाई वो थोड़ा सा रहता है. ठीक है. Okay, done, done, done. Next question. Yeah, a very beautiful question. Very beautiful question. Where do you see box shape heart? So box shape heart you can see in the Epstein anomaly. So box shape heart, it's seen in Epstein anomaly. That is another exam question. Anyone, where do you see a smooth sign? Where do you see smooth sign? Anyone? मान जाऊंगा किसी कोई अगर बता दे मुझे गलती से स्मूथ साइन, कहीं पढ़ा है गलती से स्मूथ साइन? तो स्मूथ साइन इज सीन इन, बताओ हाँ सावन किसे मिलता है? Yeah, smooth sign is seen in left ventricle hypertrophy, LVH. Smooth sign is seen left ventricle hypertrophy. Where do you see gooseneck sign? Anyone? Where do you see gooseneck sign? Who will tell me? Anji Shubhangi Kaushik, Priya, where do you see gooseneck sign? Gooseneck sign you will see in endocardial cushion defect. In endocardial cushion defect, you will see gooseneck sign. Gooseneck sign. Okay, and what else? Yeah, Muskan is saying TAPVC. What do you see in TAPVC? Anyone? In TAPVC, what is the shape of the heart? Can anyone help me out? I have forgotten. Where do you see, what shape of heart do you see in TAPVC? Any random guesses? So TAPVC, you will not just comment like that. You will say, sir, supracardiac TAPVC. Supracardiac TAPVC. If you're talking, sir, then you will see figure of 8 appearance, because infracardiac TAPVC will have a white out lung. White out lung. If I ask you just TAPVC, you will not mention. You will say supracardiac TAPVC. What is TAPVC? Total anomalous pulmonary venous connection. Totally wrong. Pulmonary veins ka connection. So when the pulmonary veins are connecting into the superior vena cava, that is known as what you call the supracardiac TAPVC. And supracardiac TAPVC will have a figure of 8 appearance. Remember that. Very good, Osama, Shubhangi, Muskan, Tanu, Priya, Mani, Nishi. Very good. The people who are answering has a very high chance of clearing exams. Very good. Okay, okay, and yeah, Acha, this is an extra question. Now that's why I am taking topic by topic. In the previous slide, we have covered TGA, then ASD, VSD, PD. We have taken one each class on each segment. So this point is box-shaped heart is seen in Epstein anomaly, but Nelson says box-shaped heart. It is also seen in one more condition. The answer is tricuspid atresia. Tricuspid atresia, because can we understand, yes or no? Whenever there is a downward displacement of the tricuspid wall, this is the tricuspid wall, right? There is a downward displacement of the tricuspid wall in Epstein anomaly, and also with the downward displacement, of the tricuspid wall, we need to understand that tricuspid wall itself is abnormal. There is an abnormal tricuspid wall. It is not the normal tricuspid wall which has just fallen down. It is the abnormal tricuspid wall. So abnormal tricuspid wall matlab tricuspid atresia. Kind of that wall is abnormal. The wall is little narrow, little shortened. Are you understanding? So tricuspid atresia itself also you can see a box-shaped heart, whereas in Epstein anomaly also you see a box-shaped heart. You need to link and study, my dear friends. You need to link and study. Okay. So Epstein anomaly, you will see box-shaped heart, and tricuspid atresia also, you will see box-shaped heart. Okay, done? Okay. Acha, this is a very good question. Let's see if you can answer. This is a very good question. I'll give you a 5-star if you can answer. All cyanotic congenital heart disease has a right axis deviation except dash, which has a left axis deviation. Very nice question. Let's see if anyone can use little brains. Dr. Savan Singh, what is right axis deviation? What is left axis deviation? Right axis deviation matlab right atrial or right ventricle hypertrophy. Left axis deviation matlab left atrial or left ventricle hypertrophy, right? So the question is, all congenital cyanotic heart disease will have a right what you call atrial or ventricle hypertrophy, except which one? The answer to this question is tricuspid atresia. Why, sir? Why tricuspid atresia will have a left axis deviation? Naturally, no. Tricuspid. This is the tricuspid wall. There is a tricuspid atresia. Atresia means abnormal narrowing. This wall is little shortened. Yes or no? So when the blood will go from the superior vena cava to right atrium, will it be able to go to the right ventricle? No. Very little very little blood will go to the right ventricle. So where the blood will go, which is too much blood here, where this blood will go? This blood from the foramen ovale will go to the what you call left atrium, and then to the left ventricle. So can we understand that so much of blood is jumping from the right side to the left side with the help of foramen ovale? So that's why you will see a left axis deviation. you will see a left axis deviation in a case of tricuspid atresia, right? You will see a left axis deviation because naturally, when so much of blood is there in the right atrium, somewhere it has to go. It cannot go into the right ventricle because tricuspid atresia is there. That valve is very, very narrow. So little blood will go to the right ventricle, but much of the blood will go from the right atrium to the left atrium and then to the left ventricle. So you can see LVH, you can see LAH, or you can see left axis deviation. Has everyone understood this much? Say yes or put a like button or say yes. Yes, इतनी कहानी समझ में आई या ऊपर से गई? अगर ऊपर से गई तो फिर तो भगवान ही मालिक है, अगर आई है फिर बहुत बढ़िया बात है. रिमेंबर, आओगे तो वेलकम, जाओगे तो भीड़ कम. हमेशा याद रखना है, ठीक है? समझ में आ गया ब्रो? हाँ जी शुभांगी, समझ में आ गया? चलो अच्छी बात है. और सुनाओ, क्या चल रहा है लाइफ में? और कुछ नहीं था तो सुनाओ. आज आज संडे है, आज क्या प्लान है? व्हाट प्लान्स टुडे ऑन संडे? संडे संडे संडे. अच्छा, ब्रेकफास्ट में क्या खाया? व्हाट्स योर फेवरेट ब्रेकफास्ट आइटम? लेट्स जस्ट चैट फॉर 1 मिनट. हाँ जी, हु हैड गुड ब्रेकफास्ट? क्या क्या ऑप्शंस है हमारे पास ब्रेकफास्ट में? क्या क्या खाया सबने आज ब्रेकफास्ट में? ओके, खाना आज इंटरेस्टिंग लग रहा है सर. खाना मतलब समझा नहीं, मतलब हाँ जी, व्हाट यू हैड फॉर ब्रेकफास्ट रॉबिन? क्या खाया आपने आज? ओके, सी आई हैड आलू पराठास. हु लाइक आलू पराठास? एनीवन लाइक मूली पराठास? और वी आल्सो हैव हरी मिर्च का पराठा. व्हाट डू यू लाइक? ओके, ओके, रॉबिन हैड एग्स. ओके, नाइस. सावन, तू मेरा भाई है, तूने भी आलू के पराठे खाए, मैंने भी आलू के पराठे खाए. वो अलग फ़र्क है कि तू मोटा है और मैं फिर भी ठीक ठाक हूँ. हाँ जी. So Shubhangi had paracetamol as a breakfast. Okay, Shubhangi, I wish you a speedy recovery, Shubhangi. Shubhangi had paracetamol for fever. कोई बात नहीं. गोली खाओ, रेस्ट करो. Why have you come to the class, dude? You should just take rest. Take rest. Don't come to classes. Go, go, go. Take rest, Baba, please. Hmm. एग्जैक्टली, रोबिन हैज़ अ गुड थिंग. संडे हो या मंडे, रोज खाओ अंडे. वेरी गुड. हाँ जी, आवर डियर हामिद ऑल्सो हैड अ व्हाट यू कॉल आलू पराठा. ओसामा, सोया था सर मैं, अचानक नींद खुली, आपकी क्लास है. ओके, अब कुछ खाना खा लेना डियर. ब्रेकफास्ट बहुत इंपॉर्टेंट है लाइफ में. एंड रिमेंबर गाइज, वी हैव टू बी हैप्पी. वी ऑल हैव टू बी हैप्पी नो मैटर वॉट एवर ट्रॉमा, डिस्ट्रैक्शन, डिप्रेशन, loneliness, negativity comes, we will be happy. I always tell you, number one, nothing should affect you. Nothing should affect you. And number two, have a zero expectation from anyone. Zero, मतलब minus expectation, I would say, not even zero. Some people say, no, 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 मैं तो बहुत कम expectation रखता हूँ. कम कम रखनी क्यों है? No, no expectation. Zero expectations from anyone on this planet. And number two, nothing should affect you. Nothing should affect you. Nothing should. Okay? That you should know. Okay, Manush Kumar Meher says, which other systems were covered already before, sir? Here we have already covered the full neonatology, around some 35 videos we have covered on neonatology, which is there on the Unacademy app. By you open the download the Unacademy, write Anand Bhatia, and you will find my name, follow and access to all the videos. And also half videos are there on the Unacademy YouTube channel. This YouTube channel, Unacademy. Go to the section of videos. Once you open this channel, once you subscribe and go to the videos, once you go to the videos, you will find my name, you will find my big face. ठीक ठाक चेहरा है मेरा, दिख जाएगा तुमको. ठीक है, इतना बुरा भी नहीं है. तो वीडियोस में जाओगे तो शुरू से शुरू करना, नीचे से शुरू करना, एंड गेट ऑल द एक्सेस. वी हैव डन ग्रोथ एंड डेवलपमेंट, वी हैव डन ऑल दी सिंड्रोम्स, वी हैव डन ऑल दी न्यूरोटोलॉजी एंड ग्रोथ एंड डेवलपमेंट. नाउ वी आर डूइंग कार्डियोलॉजी. नेक्स्ट वी विल प्लान टू डू इन्फेक्शियस डिजीज और सम गुड सिस्टम, डायरिया और एनीथिंग लाइक दैट. हाँ जी, आगे बढ़ते हैं. अच्छा, so now we have a next topic, guys. Let's be with us and let's finish this one more topic. Shubhangi says, yes, sir, expectation hurt. Don't expect, don't, nothing, zero, no expectation. Okay. Have your own journey. I always tell you, have your own journey, have your own path. Have your own journey. I read a lot of motivating quotes. Actually, I read a lot of motivating stories, videos, and a lot of good talks I hear. They always tell, like some people, if someone comes to you and tell that he was telling bad about you, he was telling bad about you, just don't listen to anyone. Say, Are bhai, I have my own journey, and I have my own growth, and I have my own vision, and I have my own path of success. So I don't have time to listen to bad things. I don't have time to listen to all this negative stuff. Let me be busy in my job and let me have my own vision. Don't even hear the bad stuff. गांधी जी क्या कहते हैं? बुरा मत सुनो, बुरा मत देखो, बुरा मत बोलो. have your own journey and everything will be fine. So let's move to the next topic. Before the next topic is truncus arteriosus. Before starting truncus arteriosus, we always have a motivating quote. And again, for today's this topic, motivating quote is, nothing can dim the light that shines from within. Nothing can dim the light that shines from within. You, we all have a wonderful soul and have a wonderful light. Nothing can dim the light that shines from within. Even though people criticize you, even though people make fun of you, even though people abusive to you, even though people are negative about you, or whatever it is, A to Z, if you are a happy soul from within, if you are a happy soul from within, you will always be a happy soul. If you are a negative soul from nature, you will be a negative soul. If you are destructive, destructive spelling क्या होती है मुझे याद भूल गया. If you are destructive, what you called, from the beginning, you will be destructive. And if you are a constructive person, you will be constructive. So the moral of the story is happy soul. Nothing can dim the light that shines from within. Today's topic of choice is truncus arteriosus. We need to understand five important points of truncus arteriosus. What happens in truncus arteriosus? So this is a four-chambered heart. In the four-chambered heart, normally we know this is the pulmonary artery and this is our aorta. Yes or no? So truncus arteriosus matlab means that these two vessels are joined at one. These two vessels are now one. Now this big vessel is known as truncus. Truncus arteriosus, when two vessels are joined as one, this is known as truncus arteriosus. When the pulmonary artery and the what you call aorta have connected, this is known as truncus arteriosus. Hmm. Question number one: will the patient will have cyanosis, or will the patient will not have cyanosis? What do you think? Anyone? Yes, exactly. Osama is right. हाँ जी, exactly. Robin, हाँ जी. Okay. हाँ. Exactly. So the patient will have cyanosis. Yes or no? Whenever there is a mixing of blood, this is one of the congenital, cyanotic congenital heart disease. It is one of the cyanotic. एक्सपोर्टिन रहेगा ब्रो साइनोसिस, क्योंकि सारा ब्लड मिक्स हो रहा है ना डियर. मतलब डी ऑक्सी और ऑक्सी दोनों ब्लड जब ऐसे इकट्ठा मिक्स हो जाता है ना, तो बच्चा बहुत नीला होता है, बहुत ज्यादा. रिमेंबर दैट वे. ओके, द बेबी विल हैव साइनोसिस. यार दबा के बच्चे को साइनोसिस होगा, क्योंकि इतना एक्सट्रीम मिक्सिंग हो जाती है यहाँ पे. ठीक है, नंबर वन. Very important question number two. Is truncus arteriosus a duct dependent congenital heart disease? Very, very, very important question. Is truncus arteriosus a duct dependent? Which duct? What is this duct dependent? Means my question is patent ductus arteriosus. Is keeping the patent ductus arteriosus open? Will it be beneficial in this case, or will it not be beneficial in this case? Shubhangi, Osama, is this a duct dependent or independent? Savan is very, very right. It is, there is no use. It is not a duct dependent dependent congenital heart disease. देखो हंसी इतनी हो रही है, क्या करूं मैं. हम्म. कल भी नाइट ड्यूटी आई हैड इन माय हॉस्पिटल, आई वाज कफिंग अ लॉट. So that's it. Understood? No, this is a duct independent congenital heart. क्योंकि दोनों इतने together हैं, the pulmonary artery and aorta are so much together. So in this case, if I keep the ductus arteriosus open, why do I keep the ductus arteriosus open? Normally, sir, you keep this one. Now see this. Normally you keep the ductus arteriosus open for the shunting of the blood. Yes or no? For the shunting of the blood from left side to right side or any side, for the helping, basically for helping. But here the shunting of the blood is of no use, because all are together, both are together. So it is a duct independent congenital heart disease. There is no use इन दिस केस. इफ आई ओपन ए डक्टस आर्टेरियोसिस, फायदा क्या होगा? दोनों एक साथ ही मिक्सिंग हो रहे हैं, दोनों इकट्ठे हैं. अलग अलग तो है नहीं कि भाई पल्मोनरी आर्टरी अलग होती तो एओर्टा अलग होता, ब्लड यहाँ से वहां आ रहा होता एंड ऑल दैट. बोथ आर क्लब टुगेदर. देयर इज नो यूज of opening a ductus arteriosus in this channel. Okay, number one. So number one, the patient will have cyanosis. Number one, this is a cyanotic congenital heart disease. Number two, it is a duct independent. It is a duct independent congenital heart disease. Okay, number one. Okay, truncus. Can we see? That's it. This truncus arteriosus already I have told you. Okay, truncus. Now, okay, so what? Now let's just finish it off. It's a very easy topic. True or false? Instead of two main vessels, pulmonary artery and aorta, we have only one. Yes or no? This is true or false? So this is very, very true. Instead of two main vessels, we have only one big vessel. That's why वहाँ पे छोटा सा पीडीए खोल दोगे तो कुछ फायदा नहीं होने वाला, टाइम वेस्ट करोगे. So don't open the. Okay. Clara says English. Sorry. So in this case, good. Thank you for telling me. So in this case, like instead of two main vessels, we have only one. In this case, in one big vessel, if I open a ductus arteriosus, it is of no use. It is of no use. Okay. So mixing of blood will happen. Yes or no? Definitely mixing of blood will happen. Number two, yes. Now this is an exam question. This is a very important exam question for the truncus arteriosus. Truncus arteriosus has a classification. We will not go too much in detail of classification, but we just need to know the name of the classification. Truncus arteriosus is divided into, like, there are various types. There are various types of truncus arteriosus. The name of the classification is Collett and Edwards classification. Very importantly, according to Collett and Edwards classification, this anomaly is divided into four types. I will not go into the details of what happens in type 1, type 2, type 3 and type 4. That's for the super specialty students, not for you. At least this much we need to understand, that in a case of truncus arteriosus, number one, two vessels are clubbed into one. There is only one single vessel. Number one. Number two, keeping PDA open, no use, Baba, because vessel is only one. Where will you keep the PDA open? PDA is used to open in two vessels. It's a connection of two vessels. PDA, patent ductus arteriosus, is a connection of two vessels, but now the vessel is only one. So no use of keeping a PDA open. It will be a cyanotic congenital heart. There will be mixing of blood in truncus arteriosus, and also the types of truncus arteriosus. The classification, the name of the classification is nothing but the Collett and Edwards classification. Collett and Edwards classification, and it has of various types. We have type 1, then we have type 2, then we have type 3, and then we have type 4. In the type 1, the main pulmonary artery arises from the truncus. Now see this part. This is the truncus. Okay, this is the truncus arteriosus. The main pulmonary artery arises from the truncus and then divides into right pulmonary artery and left pulmonary artery. Like this one, right pulmonary artery and left pulmonary artery. They are saying the main pulmonary artery arises from the truncus, right? But the pulmonary artery is divided into right pulmonary artery and left pulmonary artery. But again, I will not go into detail. It's not important. Just remember, there are four types. There are four types of what you call truncus arteriosus, and the name of the classification is Collett and Edward classification. अच्छा, किस मूवी में Edward था? In which movie Edward was there? Who will tell me? In which movie Edward was there? Remember, I was in my MBBS class. I used to, have Maggie, and every day I used to watch that movie. In which movie have you heard Edward? Which movie was there? Edward was there in which movie? Who will tell me? So this was one classification. Hanji, exactly. Shubhangi is right. Twilight, very true. Okay, Bella and Edward, remember? Yes, very good. So yeah, this is the Edward classification. याद रखना, Collett and Edward classification. And also remember one more thing. There was one more classification of truncus arteriosus, that is Van Prague classification. Van Prague. Okay. So just name is important here. Truncus arteriosus has two classification. One is Edward classification and one is Van Prague classification. Prague. ठीक है. क्या था? सावन क्या कह रहा है? बहुत मैं था एडवर्ड बहुत अच्छा. और बता दे किसमें था. ट्यूलाइट में तो था ही, मुझे ट्यूलाइट याद है. देखो और कोई याद है एडवर्ड तो मुझे बता दे. हाँ जी. So we have Van Prague classification and the Edward classification. Remember, for truncus arteriosus, that's it. We need to know. How will the patient present? We all know that truncus, mixing of blood. So mixing of blood, number one, the patient will have cyanosis. Yes. Mixing of blood, the patient will have distress. Mixing of blood, kind of what all patient will have. He can have cyanosis, he will have distress, of course he can have a murmur. Very importantly, he can have murmur. That these are the important points. Number three, can he have failure? Can he have the signs of failure? Naturally, yes, he can have congestive cardiac failure. He can have the features of failure. Heart will fail to pump because two vessels should be there. Now it is just one vessel. So mixing of blood, cyanosis, patient having distress, failure, murmur, everything will happen in a clinical feature of Truncus arteriosus. Now, this is not an exam question, it's a general discussion. This clinical feature of truncus is not an exam question, okay? That you should know. Yes, very true. Robin is right. So, cyanosis, features of congestive heart failure, distress, patient can have failure to thrive, बच्चा पनप नहीं रहा है, my baby is not gaining weight, my baby is not gaining height, because two vessels are clubbed in one. How your baby will gain weight? It's all mixing of blood, bad blood here and there. So your baby will not gain weight, failure to thrive, yes. And frequent respiratory infections, of course, the patient will have frequent URTI and LRTI. There's nothing to like cram in this. It's a general features of truncus arteriosus, okay? That's it. And what else? What else? Yeah, these all things you know. Okay, what will you find in echocardiography? Very good question. What will you find in echocardiography? If this is a truncus, now this is a truncus. It's like one vessel. It's just one vessel. That's it. Okay. So what will you find in echo? Huh? Okay. Shubhangi says, I love that series. I wanted to meet a vampire after that. Even me also. I had that feeling, that I want to meet some girl's vampire. But I don't know. But because I remember, like in our MBBS time when we used to watch that Twilight series, like, how fascinating they are, right? They can climb up on the wall, and those vampire girls are so beautiful. That girl, Edward ki sister, no, that yeah, this is very beautiful. And so I was thinking about it. Anji, Savan says that yes, you should donate your blood to them. Shubhangi says, sure, you can lead the way. That's very true. So the echocardiography, remember some different thing happens in the case of truncus arteriosus. What is the echo finding? You will get a biventricular hypertrophy. Yes or no, true or false? Will you get a biventricular hypertrophy in a case of truncus arteriosus? Definitely. When this is a four-chambered heart and this is our truncus, now the pressure will become here also, the pressure will come here also. So this is known as biventricle. This is known as biventricular hypertrophy. Done? Yes, true. Shubhangi is right. Raghuvansh is right. Every single person who is participating in this show is a winner, is already a top ranker, and you will succeed without hook or crook. You will succeed. Okay, so biventricular hypertrophy is an exam question. Where do you see biventricular hypertrophy? The answer is nothing but our this one, what you call truncus arteriosus, naturally. Okay, next, done. Chest X-ray also same cardiomegaly, plethoric lung fields. This everyone knows. There's nothing to write. Very, very, very important exam question. What is the name of the procedure for truncus arteriosus? So the answer is Rastili repair. Very, very, very important exam. This is the exam. What is the name of the repair for TGA? Anyone? What is the name of the repair for TGA? Very good, Tanu, Osama, Savan, Raghuvan, Shubhangi, Robin, Indian Academy, and our Savan. For TGA, we do Jetini repair. Jetini repair. Very good. For HLHS, hypoplastic left heart syndrome, which repair do you do? Shubhangi Kaushik. For HLHS, hypoplastic left heart syndrome, which repair do we do? तो बता दे मुझे आनंद एक्सपोर्टिन ओके यस जटनी इज डन वेरी गुड रॉबिन for HLHS, what is the name of the procedure for HLHS? Exactly. Exportin is right, Rachna is right. Norwood procedure. Norwood procedure is done for the what you call HLHS, hypoplastic left heart syndrome. So three questions, one answer. PG entrance question number one. For hypoplastic left heart syndrome, which procedure do you do? The answer is Norwood procedure. PG entrance question number two. For DGA, what repair do you do? The answer is Jetany repair. And for truncus arteriosus, Restily repair. Very good, very nice. I think this we are gonna finish the whole session now. What is the normal heart rate of a 1 year old? What is the normal heart rate of a 1 year old? My doggy Oscar is barking. Someone has come at house. Hanji, multiple times repair. Very true. Yes, Mani Prakash is right. Mhm. Okay, what is the normal heart rate of a 1 year old? Like, okay, fine. A normal heart rate of a newborn. What is the normal heart rate of a newborn? The normal heart rate of a newborn is 120 to 160 beats per minute. The normal heart rate of a newborn is 120 to 160 beats per minute. The 1 year old, the heart rate of a 1 year old, like birth to 1 year, they say 100 to 160. 100 to 160. Like, I'll show you one picture, okay? This one. Now, I want you to take a screenshot of this. If possible, on your YouTube channel, no, it's allowed to take a screenshot. So, take a screenshot of this. Like only once they had asked a MCQ in this question of this, the normal heart rate of babies, they had asked only one MCQ. एक ही MCQ आया था इस पे कि मोटा मोटा roughly birth to 1 year, what is the normal heart rate of a newborn? So some book says 120 to 160 and some book says 100 to 160. So 100 to 160 by 1 year, 1 to 3 year, 95 to 150, 80 to 140, 70 to 120, and 60 to 100. So like this much, this one and this one, only two you should remember. 100 to 160 roughly from birth to 1 year, and 13 year to 18 year, like you become an adult, right? 13 year to 18 years, your heart rate will be 60 to 100. So this one dear please remember, and this one dear please remember. The only this, ये पूरा याद नहीं रखना dear, बस ये वाला याद रखना है, birth से 1 year 100 to 160, and 13 year to 18 year 60 to 100. But इतना याद रखना, that's all you have to remember. दो चीज please याद रखना, क्योंकि there was a MCQ, there was a MCQ. And if I'm speaking Hindi a lot, and if anyone doesn't understand Hindi, please message in comment section and remind me. I will speak in English also. My English is okay, but I will try to speak. Okay, that finishes today's class. Last question. Which criteria do we use to diagnose the presence of congenital heart disease? If I am a newborn and you are expecting a congenital heart disease in me, I am a newborn, you auscultated my chest and you found a murmur. Okay, I am a newborn. You auscultated my chest, and Robin says हिंदी हमारी राष्ट्रभाषा है. हाँ तो वो तो है, लेकिन there are some students who are having difficulty in understanding Hindi. So please feel free to say me to speak in English. Which criteria do you use to diagnose presence of congenital heart disease? The name of the criteria, where you have lot of points in that, we have NADA's criteria. Very, very important 5 marks MBBS question. It's a MBBS final year question. It's a MBBS final year question. Very importantly, NADA's criteria. Very good. So who had told the right answer? Very true. हाँ जी, ये क्या कर रहा है? एक्सपोर्टिंग क्या बता रहा है? एक्सपोर्टिंग SPO2 बता रहा है ना? हाँ जी, ब्रो यू आर राइट ओनली. So NADA's criteria. NADA's criteria is divided into major criteria and minor criteria. Like today 2 o'clock we have a test of 100 questions of cardiology. There also I'll be asking you this question. What is NADA's criteria? Number one, NADA's criteria is a criteria to diagnose, or to to diagnose the presence of congenital heart disease. इस बच्चे में, this child has some congenital heart. How will you detect? How will you diagnose? By NADA's criteria. It has major criteria and minor criteria. In the major criteria, number one, systolic murmur grade 3 or 4. If I'm auscultating the child, I'm feeling a systolic murmur. Systolic murmur. When the murmur which you are appreciating, like shh, 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 if some sound is coming, and you palpate your the baby's, not yours, the patient's radial artery also, and if the murmur is coinciding with the pulse, okay, like this pulse also, like dhak 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 dhak, and the murmur also shh, shh, if the murmur is coinciding with the radial artery, they always say generally it is a systolic murmur, like that the book says, but it's a rough estimation. So in general, we have major criteria and the minor criteria. ठीक है सर. हाँ जी, ठीक है. So major criteria and minor criteria. The major criteria is systolic murmur grade 3 or more, any diastolic murmur, cyanosis, and congestive heart failure. Any patient, any newborn with these features, these are the major criteria. Please, my dear friends, can we learn and revise here only? Number one, systolic murmur grade 3 or more. Number one. Number two, bolo mere saath, bolo, say any diastolic murmur. Number three, if the patient is having any cyanosis or any features of congestive heart failure, like periorbital swelling, facial puffiness, raised JVP, tender hepatomegaly, ascites effusion, or orchitis, or pedal edema. Like congestive heart failure is a separate 1 hour topic, someday we'll discuss. So just remember, these are the 4 important major criteria. What about minor criteria? Minor is systolic murmur grade less than 3. Number one. Number two, any abnormal second heart sound, S2. Third, any abnormal ECG. And fourth, any abnormal chest X-ray or blood pressures. These are the important ones. And remember, like 1 plus 2, one major or two minor. One major or two minor what you called any one major or two minor will be like a positive NADA's criteria. In some may say at least one major or two minor criteria should be there to say it for the NADA's criteria. That's another exam question. 1 plus 2. Remember 1 plus 2. Okay, that's what you remember. 1 plus 2. Someone is very, very right. Hamid is right. Tanu is right. Exporting everyone is mind blowing right. That finishes NADA's criteria. Okay. And grades of murmur, I think you guys know. I'll not go for details of grades of murmur. That's it. And this is the major and minor criteria for the NADA's criteria. That's it. And that's it. Now we're going to end up this session. Thank you so much for the participation. See you at 2 o'clock. At 2 p.m. today we have a class, and at 4:30 p.m. we have a class. Then 6 o'clock I'll go for running in the park, and I will lose a lot of what you called. I'm getting abs. I'm so happy, and I'll do a lot of push-ups and sit-ups, and I'll have a very good physique. And that's it. And yeah, the homework for today is, what is the total fetal cardiac output? What is a newborn's cardiac output? And these three questions are their homework. Okay, question number one: what is the total fetal cardiac output? That is the first question. Second question, what is the newborn baby? A newborn baby's normal cardiac output. And question number three, in Wilson disease, as you know, in the Wilson disease, we have this gold standard investigation of choice is liver biopsy. So how much microgram dry weight of liver of hepatic copper content is diagnostic for the what you call Wilson disease? Wilson disease is a copper everywhere. No, Wilson disease copper everywhere. Serum copper increases, hepatic copper increases, urinary copper increases. In my eyes also, descendant membrane of the cornea, there is a KF ring because of copper deposition. So in my liver, it's a diagnostic investigation of choice is liver biopsy. If you cut my liver and do the biopsy, you will see the hepatic copper content. How much it should be? How much it should be? Okay. हाँ जी. Okay. तो ये क्वेश्चन है. Remember you should know. Okay. Robin says सर फिटनेस कोच बन जाओ आप. बिल्कुल सर. अरे हम है, बाकी पानी कम है. So this was the homework. तो जाने से पहले we have this very beautiful quote which I really like it. Please listen to this quote. Okay, it's a very nice quote. In order to love who you are, it's a very beautiful quote. Please listen to it. कल ही मुझे मिली और मुझे बड़ी अच्छी लगी थी. I yesterday only I found it and I really liked it. In order to love who you are, you cannot hate the experiences that shape you. So it's a very beautiful quote. In order to love who you are, you cannot hate the experiences that shape you. You know, some people says, "Oh, I wish I didn't have that bad experience. Oh my God, I wish I didn't have that thing in my life. Oh, I wish God would not have done so much bad to me. Oh my God, I every problem is in my life only." So don't do all that. In order to love who you are, you cannot hate the experiences that shape you. Those negative things only have shaped you. Those hardship, those struggle, those जो संघर्ष तुमने देखा है, वो that struggle which you have seen in your life, that only things have shaped you. Okay, people, you know, there's a quote, right? People who hate me motivate me. People who hate me motivate me. So our haters itself, they motivate us in a very beautiful manner. So in order to love who you are, you cannot hate the experiences that shape you. So don't say that I had the worst experience or bad experiences. Those worst and bad experiences only have made you a person you are today. Actually, the good things, you know, अच्छी चीजें इतना नहीं सिखाती, बुरे लोग ज्यादा सिखा के जाते हैं. Good people don't teach you that much. The bad people, the worst people, the critics, basically the critics are the one that make you very immune. The critics are the one that make you very strong. The critics are the one that make you very bold and very strong. Are you understanding? The sweet things don't make you strong. It's the rough things which make you strong. So the moral of the story is that in order to love who you are, you cannot hate the experiences that shape you. So that finishes today's session. Thank you so much for the participation. See you after 2 hours at 2 o'clock, same Unacademy YouTube channel with the top 100 pediatric cardiology questions test. And let's see who answers. और जो जीतेगा उसको मिलेगी बहुत सारा प्यार, बहुत सारे hugs and बहुत सारा respect. Hmm. Robin Khatri says, but we all love someone else. Whom do you love? Whom? Whom do you love? Someone. किसको प्यार करते हो तुम? हाँ जी, हामिद says, sir notes please. कौन से notes dear? I didn't get you, हामिद. कौन से notes? एक क्लास देखो, किताब खोलो, कॉपी पेन लिखो, इस नोट्स बनाओ अपने आप अच्छे बच्चे की तरह. सब कुछ तुम्हारे सामने डियर, सब कुछ तुम्हारे सामने. स्लाइड्स का पीडीएफ क्या करोगे? घर लेके जाओगे पीडीएफ को? कहाँ आरती उतारोगे पीडीएफ की? ये रहा यूट्यूब चैनल, इट्स ओपन, इट्स फ्री। टेक अ पेन एंड अ कॉपी, मेक नोट्स। शेयरिंग पीडीएफ, आई डोंट फील इट्स अ गुड आइडिया। इज बेटर वी शुड मेक आवर ओन नोट्स। थोड़ी देर लगेगी, थोड़ी मेहनत लगेगी, अगर हो पाए तो कोशिश करो बनाने की। आई थिंक वो ज़्यादा बेनिफिशियल। बाकी देख लेंगे। हाँ जी। ओके निशी अग्रवाल, टेक केयर, हैव अ वंडरफुल टाइम एवरीवन। फिर भी कुछ चाहिए हो तो हामिद बता देना यार, कोई टेंशन नहीं है। सी यू एट 2 o'clock आफ्टर 2 hours, एंड